contrary to what President Trump is saying. And Dr. Fauci could not be more clear about the fact that he believes that we are on the verge potentially of losing control of this pandemic, and that if there isn't a really strong course correction at this point, we may run out of time. And I think that's what you're seeing many of these Republican governors responding to. Texas is incredibly important because that was one of the very first places to try to reopen as quickly as possible. Now they are seeing the consequences of that, and Greg Abbott is making a sharp course correction that is a signal to President Trump that he should not view what is happening on the ground as some kind of effort to hurt him politically. These are real people who are now being hospitalized, many of them younger and younger by the day, and the result of this is going to mean the country will have to close back up again in order to save lives.
And John Harwood, another major development today, Herman Cain, who attended the president's rally just a few weeks ago, the former presidential candidate, is now hospitalized with coronavirus. Is the Trump campaign acknowledging the dangers of these events? We were hearing earlier that they did contact tracing. The Trump campaign is claiming that. But we're hearing from our Jeremy Diamond that Paris Denard, who is photographed in that picture right there behind Herman Cain, told CNN he had not been informed about Cain's positive diagnosis or his hospitalization earlier today.
Jim, they're plainly acknowledging the danger. They did that by requiring people who attended that rally to sign a waiver of liability in case they got sick. Now, the people of Tulsa acknowledged the danger themselves by, in many cases, staying away from that rally. The arena was only 1/3 full. We can tell that Americans in very large numbers are still alarmed by the state of the virus. It's interesting, the NFL indicated today, or one of the teams at the NFL indicated that fans would have to sign a waiver of liability if they decide to go to an NFL game this fall. It's going to be a very interesting experiment to see how many people want to go to Trump rallies or NFL games so badly that they're willing to assume the risk of coronavirus and overcome the fears that they plainly have of this mushrooming pandemic.
And Abby, obviously we want to see Herman Cain recover fully from what has happened to him, catching the coronavirus. But when you look at that picture of Herman Cain in the crowd at that Tulsa rally and you see these faces around him, this is from his Twitter feed. Obviously these folks were not social distancing. They look like they're having a good time there, but they were not social distancing, taking cues from the president, taking cues from the Trump campaign. This is a visual reminder of how this is just a mess, cramming people into confined spaces like that.
Dovetails with Maya's point that the people who are left working for Trump, be they political or career, know that he's not going to hear it when it comes to Putin.
Yeah, so this is the issue, is that there's essentially become this kind of two-tiered briefing system inside the White House, where you have the PDB, which includes a couple, probably a dozen articles per day that the president's expected to read about major hotspots, about national security threats that just need to be on his radar. And then you have his intelligence briefer, who only has a few minutes with him every day, has a very limited amount of time, especially given the president's tendency to go off on tangents and kind of rant during these briefings. And they need to choose what to prioritize in that moment so that the president can know what is the most urgent thing that he needs to attend to that day in the realm of national security. So with regard to the Russia matters, his intelligence briefers have essentially internalized this notion that if you bring up Russia around him, he's just going to explode. He doesn't want to hear anything about Russia. He doesn't want to be second-guessed about his relationship with Vladimir Putin and whether or not that may have impacted the 2016 election. And to that point, he's already called this intel a hoax on Twitter. He has not actually said that he believes it and that he is working on it and that he is coming up with a response with the National Security Council, with his administration. So this is more of a clear pattern of his intel agencies just really struggling to get through with him on this issue.
Protecting a city of 121,000. Traffic went from 12 cops to 0. Detectives from 15 to 4. Canines, 4 dogs to 1.
Crime ran amok. People, especially traffic.
Former officer Ann Vallejo's now mayor says defunding was a disaster.
It was nothing to drive down one of our main streets and see somebody blow through a signal light like it wasn't even there.
Pay went down. Veteran cops left. Young officers quit, afraid of being laid off. Police shootings went up.
Break into a store or break into a house, and it's going to take the officers 20, 30 minutes to get there, if they come at all.
Morale hit an all-time low. Auditors found burned-out cops adopted a us-against-them mentality. Protesters say 14 cops on the force have been involved in at least one shooting.
Not one more! Not in our city!
The mayor supports police reform, as many residents have told him, but they also expect public safety.
They want to be able to say, I can walk down the street without fear of getting mugged. I want to be able to walk up to my car and see that it's still there. I want to go home and not find my front door kicked in.
The cuts allowed the city to escape bankruptcy, and neighborhood watch groups increased 25 to more than 300. But many believe a smaller department didn't make it a safer one for police or the public. Mike?
William Lajeunesse. Thanks a lot.
We're now Thank you. Mr. Chairman, ranking members of the committee. Good morning. My name is...
As Anthony Fauci said this week.
Well, let me just say I am on the coronavirus task force, so I'm happy to answer a few of those questions. I can't comment on the schedule of briefings. I'm not aware of that. The president specifically put in his speech encouraging Americans to wear masks, social distance, and hygiene, because he's the president of the United States and people are not around him close, and the people who are around are tested. I don't think he needs to wear a mask, but the rest of us absolutely, and the president supports wearing masks. I was at the House this week testifying. I'm sure you saw my picture with Chair Powell on the Wall Street Journal. I never thought we'd have a picture like that. But yes, we are encouraging Americans to wear masks. Now, unlike last time, as I've said, and yes, I realize the numbers of cases, we're monitoring that carefully. We're monitoring the hospital capacity. Let me just say I've been briefed on where we are on vaccines and virals. I'm very encouraged we'll have things by the end of the year. So yes, we're going to be careful. And I wouldn't say reverse. I would say the states appropriately are pausing certain things like bars and gyms, which obviously are the more contagious types of things. And I think the states are acting appropriately.
Mandating masks is now requiring them. Plus, the top Trump supporter now hospitalized after attending that Tulsa rally. New hires and lost work. The president celebrates as the economy adds nearly 5 million jobs. But will that work dry up as businesses are forced to shut down again? Alleged Epstein accomplice arrested. The girlfriend of disgraced billionaire sex...
Entice minors to travel to engage in illegal sex acts. Her arrest 1 year after Epstein was indicted. Tonight, the details, and we hear from one of Epstein's victims. Your money tonight and the record job gains. Nearly 5 million jobs added last month. President Trump calling it proof the economy is, quote, roaring back. Critics cautious and Joe Biden pouncing, with 19 states either reversing course on reopening or hitting the brakes. What American workers told us about being laid off for a second time. The armed parking lot confrontation, a woman drawing a gun on a family after an altercation at a Michigan Chipotle. Tonight, the husband and wife charged. The disturbing video under investigation from inside the Miami International Airport, an officer punching a woman in the face. The fireworks warning this 4th of July after a stand explodes in Texas. And celebrating a legend tonight from our ABC News family.
This is ABC World News Tonight with...
Virus is real. Infections are now up in 37 states as more and more people who get screened are testing positive. At the beginning of June, Florida was averaging about 600 new cases a day. Today, there were 10,000 new infections. With ICU beds reaching capacity and lines for testing stretching for blocks, mayors and governors nationwide are now bringing back strict restrictions and begging Americans to spend the 4th of July at home. Texas's governor, who has spent weeks pushing back on the idea of mandating masks, just issued an executive order requiring them in public places across most of the state. Tonight, the virus has killed more than 128,000 people in the U.S., and there are more than 2.7 million confirmed cases nationwide. While today's jobs number provided some glimmer of hope, with 5 million new jobs added in June, economists worry that if the country shuts down again, that work will go away. There's a lot of news to get to tonight, and our team of correspondents is covering it all. CBS's David Begnaud.
Doing some amazing work. Our hats off to your team down there. Dr. Boom, how far will this new order on masks go in addressing the crisis in your state, do you think?
Thanks, Jim. Well, I've got to say, I am absolutely elated that this order was put out today. We've been looking for something that we can help bend the curve with. We have had a number of things sequentially happen over the last couple of weeks.
Live from KELOLAND Media Group, KELOLAND News at 6.
Ready for a presidential visit and fireworks display at the Shrine of Democracy. But it's a visit some would rather see canceled. We share their concerns ahead on KELOLAND News at 6.
Good evening. It will be a historic day in the Black Hills. By this time tomorrow, President Donald Trump should be on his way to the celebration in South Dakota.
The president is coming for the first fireworks show at Mount Rushmore since 2009. We have team coverage from the Black Hills, and we begin with KELOLAND's Kelly Volk. She joins us live at the National Memorial. Hey, Kelly.
Yeah, Brady and Bridget, we're still 24 hours out from the main event, but it's already a pretty busy night here in the Black Hills. I drove through Keystone to get here. The town was packed with cars and people on the sidewalks. Now I'm here at Mount Rushmore, and we've got people coming and going just for a typical night at the monument. That all changes tomorrow, of course. This place closes down at midnight. It stays closed tomorrow to make way for the president, the fireworks show, and all of those ticket holders who will be coming to see him and the fireworks. We're going to be here for the whole thing, so we're going to bring you coverage of the addresses that are made to the crowd and the fireworks display. So be sure to join us right here on KELO TV and on KELOLAND.com. Reporting live at Mount Rushmore, Kelly Volk, KELOLAND News.
All right, thank you, Kelly. Well, a retired superintendent of Mount Rushmore is actually calling Friday's fireworks show a terrible idea. Cheryl Schreier has written an op-ed published this week in the Washington Post saying the event should not take place because of the threat of wildfires and COVID-19. KELOLAND's Perry Groten spoke with Schreier, who says remnants of past fireworks shows were still turning up at the park years later.
Former Mount Rushmore Superintendent Cheryl Schreier says she's concerned Friday's fireworks show may spark a wildfire at the memorial.
Compounded by that is the fact that when you have that many people in one place, evacuating people in a quick fashion is just way too difficult.
Schreier served as Mount Rushmore superintendent from 2010 to 2019. She was involved in the decision to end fireworks shows 10 years ago.
It was a very prudent and responsible decision, knowing what we knew about fireworks and the damage that it could cause.
Schreier says as late as last year, she was still finding fireworks debris around the memorial.
Anytime it would rain, you would still find all of the debris from fireworks. Plastics, I've actually seen plastics that have been embedded in the sculpture itself in the front from fireworks.
But it's not just fire danger or environmental issues that have Schreier concerned. She says hosting thousands of people from across the country is a recipe for disaster when it comes to the coronavirus.
It could be a tragedy in the realm that nobody really knows what will happen after this event if people leave and contract the virus, expose all of the visitors and also all the employees.
Schreier says it's unlikely organizers will heed her advice to call off Friday's show, but she hopes her speaking out now will alert people to the potential risks. Perry Grote, KELOLAND News.
Schreier says it's ironic that organizers won't lower the number of people attending the event for the sake of social distancing, yet Mount Rushmore won't allow regular visitation for the entire day. You can read her entire Washington Post opinion piece by going to this story at KELOLAND.com.
And we'll continue our live coverage from the Black Hills in just a moment, but first, let's check on your forecast with Chief Meteorologist Jay.
Now we'll have to shut down again.
And in states like California, where some businesses have closed for good, one local sheriff is handing out $300 tickets to anyone not wearing a mask.
The measures all in place.
Lake County Fair in Spencer, Iowa will be held off until 2021. Officials say after exploring all possible options, they concluded it just couldn't be done. According to officials, following health recommendations and increased sanitation would have made fair traditions unrecognizable or eliminated outright. The fair usually brings in 300,000 people to the area on an annual basis.
Staying in Iowa, the number of additional cases of the coronavirus continues.
As many as 1 in 100 or even 1 in 70.
California, one of 23 states now pausing or rolling back reopening, but Florida's pushing forward despite more than 10,000 new cases today. A record.
I think we're a family-owned business, aren't we, Dad?
We sure are, boys. Well, whenever you're ready to step back,
to have it. That picture that every mom wants of the baby being born and holding the baby, does that happen with babies in COVID?
Unfortunately, no. We have to, as soon as the baby is born, they do bring him right to us outside of the door. So it's just a very brief moment, but the mom might get a glimpse.
In the womb, the virus isn't typically transmitted from mother to child, but during the birthing process, the risk of infection goes up, and treating newborns with the coronavirus, much more complicated. Though these babies have tested negative, they are treated as suspect positive. Healthcare workers wear full PPE, and these babies born to moms with the coronavirus are kept separated from others, just in case.
19. Believe it or not.
Now through our First Alert Weather app, the First Alert Weather Team, only on Dakota News Now.
Face. The virus spreads through respiratory droplets, so it's really important to cover your mouth and nose when you cough or sneeze. Hands down, the best way to prevent illness is to avoid being exposed. Be smart. Stay safe. For more information, visit covid.sd.gov.
Rushing, and with rates of infection rising, they expect more work and stress ahead.
Stress exploring all possible options, they conclude it just couldn't be done. According to officials, following health recommendations, eliminated.
Drive you nuts at first, but you get past it.
28-year-old Michael Vasquez works in a warehouse. He isn't sure how he got sick. He's part of a new program here to get patients up and walking as soon as possible, even a little bit, helping both physically and mentally.
What has it done to your lungs?
It really made them fatigue really bad with the sorry.
Vasquez isn't sure if there will be any long-term effects to his lungs. Right now, he's focused on getting home to his wife and 7-year-old son.
I just miss, their presence, miss holding your wife, kissing your son goodnight, going to his room, making sure he's okay. I miss that a lot.
We know that when people walk,
With new cases,
I think on some level we're having to relearn it with COVID because of our response to it. Obviously our need to keep ourselves safe, to keep staff safe. So it's not unexpected that we kind of ended up isolating people, whether we meant to or not.
Another lesson of the pandemic, trying to reduce recovery times and free up beds, badly needed for an expected growing surge of people seriously sick with the coronavirus.
Right now, we are so full upstairs that we are having some delays in getting the patients upstairs because there just aren't beds that are prepared and ready for COVID patients. So we are holding a lot of them in the emergency department right now. Some for hours, some for days.
What's driving the surge here? Doctors aren't entirely sure, but based on what they hear from patients, there was a sense that the worst was behind us.
I don't think that there was one specific incident that really led to this spike. I think people after March and April were extremely frustrated with being inside, and as soon as those restrictions lifted, they wanted to get out. Some protected themselves, some didn't, and now we're just seeing the result of that.
With the whole
to provide just under 200,000 meals for
is coming.
Ways, high fives, for example. The power of a high five is
in this every night.
Well, I think that he's already said that he's going to
South. Late this afternoon, a federal magistrate in New Hampshire ordered Maxwell into the custody of the U.S. Marshal Service to be taken to New York. There, prosecutors are expected to ask a court to hold her without bail. They say she is at extreme flight risk. Ben Weeder is an investigative reporter with
Trevor.
That was quick.
That was everything and nothing. The way that they manage patients has changed, and they've been able to manage PPE better and put patients in a way that and arrange them in a way that it protects the staff more. The way that they treat COVID has certainly changed. The de-emphasis on ventilators right now. But what is exactly the same? That terrifying sense that we don't know what is coming next in Texas. That is one thing that is unlike anything we saw in New York. While officials there had a fairly good sense of where they were on the curve and how much more they were going to have come through their doors, there's no sense of that here, and there are record numbers of infections. The state has now reversed itself. The governor here has reversed himself on masks. There is a real sense that it is a crisis spreading like a wildfire, and we don't know when it's going to go out. Kate?
And when it does, how bad is it still?
I mean, it's quite terrifying, to be honest. There's nothing like the feeling of not being able to breathe. You know, it's a very distinct feeling, and it's extremely uncomfortable. And when it starts to come on, I start coughing, and I'm clearing my throat constantly, and then I get sort of a tightness in my chest, and it just feels like I have to work and think to breathe. And, you know, it's just a harrowing experience in general.
You can imagine. I mean, and I've heard you talk about the kind of mind games, the psychological toll that you deal with from this virus. What is that like?
Well, there's two parts to it. I mean, first of all, we're dealing with a virus here that we've never dealt with before. So we're kind of just now starting to learn the short-term effects of this thing, but also we're learning the long-term effects. And I think that's, first of all, very scary because there's so much unknown with this thing. But the other scary part is feeling better. It's not like getting the flu or a cold virus where, you know, you start feeling better after a few days and then your trajectory is just, you know, on the way up. But with this thing is that I would feel better for a few days and then it would just come and smack me again. I mean, in the very beginning, I had 2 days of symptoms and then I felt like $1 million for 3 days. And so I was, you know, thought I was off the hook and thought I had beat it, but then it came back with a vengeance.
I mean, you're a dancer. You are a performer. You live in peak physical condition. I mean, are you afraid that the way you feel and what you're dealing with is somehow now your new normal?
Absolutely. I think about it all the time. I mean, I've been doing 8 shows a week for, 15, 20 years or something. I've been doing theater and Broadway and, dancing and doing, 8-minute tap dance numbers and being fine. And my lungs have always been great. But now the capacity is just not the same. And, I'm just praying daily that they'll get back to normal and I'll be able to do those things again.
Is there any way to know? I mean, what are your doctors telling you about this?
Well, my doctor does think it will improve. And multiple doctors have told me that, that it's kind of a pendulum swinging in your system. And eventually the pendulum will stop. But, this is a new virus. So we really, I guess, don't really know. But, I'm just trusting that that's what's going to happen.
Yeah. And I know that you have been wanting to speak out because you want to warn people. You recently wrote very passionately about what is going on right now and what you're seeing and feeling with these surges that are taking place in the country. I just want to read just a part for folks. You wrote, "I cried watching the news tonight. Cases are spiking. The president makes jokes about coronavirus. People shame others for wearing masks. The country is making it a partisan issue." And you go on to say that you wouldn't wish this on your worst enemy. I mean, having gone through what you have, how do you feel when you see what I've been talking about all tonight, when you see states reopening and you see surges happening?
I think we have to focus on the collective and we have to take care of each other. And like I wrote in that post, it's not a partisan issue, it's a human issue. We have to take care of each other because, if one of us is hurting, we're all hurting. So it really is it's about teamwork this time, with this thing. And we all have to come together, wear masks, socially distance for as long as we can until there's a vaccine because, this thing has an infinite variable of outcomes for people. There's short-term, long-term, and we just don't know. So it's just really important that people take care of each other. And I just really don't want other people to have to experience what I've experienced.
Yeah, take your story and listen and take.
But as those storms move to the east, it looks like they'll not be.
They did it. So why live with your dog stressing out during...
I had to change.
Insists his is a sea change shift. At the expense of taking short-term business in, we signed long-term contracts because this is the only way, in my opinion, for us to justify infrastructure investments, which is what we need in order for this PPE problem to not be a supply problem going forward.
One thing that's happened during my repertorial lifetime has been the move from just in case to just in time.
Yes.
No warehousing of anything. Is there going to be a sea change, do you think, in how American business does business?
This is the beginning of understanding how vulnerable we are to our ports closing. The business of building things is going to be a function of national security in addition to ease and access.
Are we moving back from just in time to just in case manufacturing?
No, not yet. I think that if the COVID crisis fades from our consciousness, that the industry will quickly go back to waiting for imported products to show up and not solving any problems.
But Merrow, for one, plans to produce PPE here for years to come. Paul Salmon in Fall River, Massachusetts.
Throughout this pandemic, we have profiled many frontline workers whose jobs have been deemed essential. Tonight's Brief but Spectacular introduces us to Savoya Taylor. She works as a line worker for ComEd, which powers Chicago and much of northern Illinois. Taylor is the company's first female overhead electrician, and she spoke to us about her work and her family.
Just imagine this pandemic without electricity. You know, everybody was running out to the grocery stores. With no electricity, you have nowhere to store that grocery. No television, no cell phones. We are definitely called first responders in our position. So we're basically the first ones out there. I work on the north side of Chicago, also part of the west side. This was definitely not the career I was growing up on, saying, oh, I'm going to be an electrician. I'm the only lady. The guys treat me well. They treat me as if I'm one of their own, so it's an amazing position to be in. Actually, my whole household were all essential workers. I have a daughter. She works for the company as well. She works for customer service. I have another daughter. She works at a restaurant. I also have a son at home. He was diagnosed with Hodgkin's lymphoma in November, my 12-year-old son. His days, my son wants to just be right up under me, and I'm like, give me a second, let me get out of these clothes, shower, and it's just hard, you know, when you got a young child at home that wants to love and hug all over his mother and his sisters and stuff, and we just trying to keep a good distance just to keep him safe. To be out here working every day and not knowing if I'm going to contract this illness or not, I definitely have to try to not bring it home to him. And you know, it's days where his strength isn't up and he have to do the chemo and everything. So these type of diagnoses is hard on adults. So just imagine a 12-year-old boy that don't even understand, like, why me? He asked me that, why me? And I didn't even have an answer. I just told him that things happen to people sometimes, but just continue to be strong and we'll get through it. He inspired me so much. He has showed me that you just can't give up. I worked really hard to be here, and I'm opening up, trying to be positive for a lot more ladies to come behind me. And I'm also trying to train my youngest daughter to do what I'm doing, teaching her how to climb. She wants to follow into my footsteps, so that really makes me proud. My name is Savoya Taylor. This is my brief but spectacular take on empowering my family and my community.
You go, Savoya Taylor, and we're thinking about you, your son, and your whole family. And you can find all of our brief but spectacular segments online at pbs.org/newshour/brief. And before we go, an update to the ventilator challenge story that John Yang reported on Tuesday. The winner of the COVID-19 challenge to build a cheaper, easy-to-use ventilator has been announced. It's a team from Smith College in Massachusetts. They won for their design of a simplified, cost-effective ventilator. In 2 months, the 30-person team of mostly women went from knowing nothing about ventilators to having a fully functional prototype. Congratulations. On the NewsHour Online right now, we explore how
hugged by a layer of grilled cheese. It's available now at Taco Bell's nationwide. Yes, please.
Yeah, we got to take a second and process that. There's been a change to a Major League Baseball game set to be played in Iowa. The Field of Dreams game will now see the Chicago White Sox play the St. Louis Cardinals. Originally, it was supposed to be the White Sox and the New York Yankees, but the pandemic forced a change in teams. A temporary 8,000-seat stadium is nearing completion in Dyersville area, right next to where the movie Field of Dreams was filmed. At this time, it's unknown if any fans will be allowed to attend that game. We're on the warm side again tonight. Phil will have a final look at our forecast when we come back as we go to break.
Call what you're seeing right here in those numbers, in those facts on your screen, embers. That's the word they use. But it's not only false, it's also insulting to anyone who could read the data, or even more so, has lost someone they love to the disease or might be fighting it themselves now. Today, the president used similar words to gloss over what is the truth.
Our health experts continue to address the temporary hotspots in certain cities and counties, and we're working very hard on that.
Not at embers in that case, he said temporary hotspots, but the fact is, it's more like a wildfire. In any case, the president says it is all going great.
We have some areas where we're putting out the flames or the fires, and that's working out well. We're working very closely with governors, and I think it's working out very well.
Sadly, that's both, again, false, but also a recurring theme. The president seems deliberately unwilling to learn or acknowledge how outbreaks grow, and has been from the start.
When you have 15 people, and the 15 within a couple of days is going to be down to close to zero, that's a pretty good job we've done.
That was on the 26th of February, and
where they were writing, once you were our beacon, you were what we wanted to emulate. We wanted to be America, and now all we can see is total American failure. We cannot believe it. You see essays like this in every single language around the world, in newspapers and magazines and in broadcasting. It's just a sense of, oh my gosh, how did America fail this deeply? How could this be? The leader of science, the leader of democracy, the leader of the free world, and the number one economy. And it's the number one complete failure when it comes to this pandemic. It's astonishing. And then we add salt to the wound when we say to the rest of the world, oh, by the way, we're not going to play nice in the sandbox either, because we're going to turn around and buy the entire supply of Gilead Remdesivir, the only drug out there that's been recently shown to be effective in reducing the length of time of illness other than dexamethasone. And we're going to buy it all up so the rest of the world can't get any. And to the rest of the world, this is viewed as, once again, America saying, it's us versus all of you. We do what we want. Yeah. We're going to take the vaccine first. We're going to take the drugs first. To heck with the rest of you.
In identifying the difference, I mean, it seems to me the sort of most clear-cut problem when you look at us and other countries that had bad outbreaks, right? So there's a whole category of countries that sort of avoided terrible outbreaks to begin with, which is great. That's what you want to do, right? But then there's the countries that had really bad outbreaks, and that's Italy, and that's Spain, and that's France. it seems to me the key difference is those countries basically kept things locked down long enough to get down to a possible suppression level, to then do the kind of putting out the embers strategy that we never did. Like, we never really actually got it under control in a way that would allow that. And so when we opened back up, it was inevitable we would have this.
Well, we didn't get it under control in the way that you're describing nationally, but New York, New Jersey, Connecticut, key states Northeast did, and made the proper sacrifices and got their epidemics under control. I think really, Chris, there's two key things. One, it's obviously your national leadership question, but it's also that every single European country you named has a national health system. And that means that they have always centralized data, centralized purchasing, centralized policy, so that it would be easy in Paris for Macron to turn to his health minister and say, what do you think we should do? And the health minister puts some scientists together and says, here's what we should do. And boom, it happens for the whole country. Here we have a completely fragmented response. I mean, just today, Representative Andy Biggs in Arizona called upon the White House to shut down the coronavirus task force and get rid of Tony Fauci and Deborah Birx. And you had, meanwhile, Andrew Cuomo saying, we've done a great job, but we're not going to allow the following states, big long list, to send any of their people our way because they have too much COVID. We're acting more like 50, and if we should include Guam and Puerto Rico and so on, so 50 plus individual nations than we are like a single national response.
The only sort of moonshot here, as far as I can tell, is like a very fast 100% mask adoption. The data that's accrued over the last several months has really suggested that in terms of like effectiveness versus cost and hassle, it's the sort of easiest thing we have. You have Abbott today issuing a mask order for any county in the state that has over 20 cases, which is basically the entire state. You've got this tweet from the South Carolina governor, Henry McMaster. Let me make it very clear. Wear a mask and social distance now so we can enjoy high school and college football in South Carolina this fall, which is sort of perverse at one level because there's other things that are even more important than that, but also maybe good for the target audience. I guess my question to you is like, can we do it short of massive interventions? Is everyone masks up? If everyone gets on the same page, can we arrest the growth we're seeing now?
Well, look at it this way. The choice, mask or not to mask, is being described as if it were an economic choice, as if somehow by wearing a mask, you were opposing the opening of the economy and you were somehow, in favor of a lockdown. And that if you didn't wear a mask, you were somehow gung-ho for the economy. But Goldman Sachs just released a report that says actually we could save 5% of our GDP loss. I mean, enormous, trillions of dollars to the U.S. economy, and that means a lot of jobs, if every single person, when they left their home, was wearing a mask at all times. That's a very simple intervention. It's cheap. Anybody can do it. It requires no skills whatsoever. Just put the mask on so that it covers your nose and your mouth, and you're set to go.
Hey, we're going to have this by the end of the year. I was surprised that they're being that sort of dogmatic. Dr. Fauci has said the same thing. So certainly you have to weigh that into our optimism. Everybody, just about everybody on the planet wants this, and I'm optimistic, but I'd like to see the data. I'm still surprised that we haven't seen a lot of data around this.
Sanjay, Professor Hazeltine, good to have you both on tonight. Sobering commentary.
Are allocated. As the U.S. Attorney in D.C., all I can tell you is how do we charge cases? How do we look at the evidence? And what I can tell you in that regard as a prosecutor is we are charging cases not on the basis of political affiliation. We're charging cases on the evidence purely.
Amen. Equality under the law. That's what we need to get back to. Thank you. You're so nice to come and explain that to us. Thank you very much.
Thank you.
David Paul Kuhn has thought a lot about what's going on big picture, because a lot of things are. He's the author of a...
Because he's now... Well, with the coronavirus surging in America today, on a day when the country once again set a new record for the number of coronavirus cases reported in one day, Donald Trump held what the White House called a press briefing, but after giving a rambling statement about the economy, Donald Trump just walked out of the briefing room in abject fear of taking a single question.
Thank you.
Thanks. The Russian bounties in your PDB.
He did not dare take a single question. He was afraid of taking any questions about intelligence reports that Vladimir Putin, who Donald Trump has never once criticized, is paying the Taliban to kill American soldiers in Afghanistan. You heard that question about the president's daily brief being yelled at him as he walked out that door. Donald Trump was afraid of taking any questions about the coronavirus, which is now out of control in the United States. There's no other description for it, including out of control in the biggest Republican states, Texas and Florida, where the Republican governors have followed Donald Trump's lead and done the least they could possibly do to protect their citizens from the coronavirus. Our first guest tonight, former Texas Congressman Beto O'Rourke, has this explanation for what is happening in Texas. Want to know why there is an uncontrolled COVID outbreak in Texas with a record number of cases, hospitalizations, and soon deaths? Because Dan Patrick leads a death cult that Abbott, Cornyn, and company are too scared to stand up to. Dan Patrick is the Trumpian lieutenant governor of Texas, who had this to say on Tuesday after Dr. Anthony Fauci testified to a Senate committee.
Locking down doesn't work. If it did, those two states would be doing better than Texas. Fauci said today that he's concerned about states like Texas that skipped over certain things. He doesn't know what he's talking about. We haven't skipped over anything. The only thing I'm skipping over is listening to him. He has been wrong every time on every issue. I don't need his advice anymore.
Today, the Republican governor of Texas, Greg Abbott, reversed himself once again by ordering the use of masks in Texas. The order requires Texans living in counties with 20 or more positive COVID-19 cases, which is most counties, to wear a face covering while inside public spaces or whenever social distancing is not possible. And the governor has established a penalty structure. First-time offenders of the order will receive a written or verbal warning. People who violate the order more than once will receive a fine of up to $250 for every violation. Now, this is the very same governor who 2 months ago blocked local government in Texas from penalizing people who would not wear masks. Now, the governor of Texas is issuing a $250 fine for anyone who doesn't wear a mask in 186 Texas counties. The governor issued that order on a day when Texas once again broke its own record for new coronavirus cases reported in a single day at 9,169. Today, Dr. Anthony Fauci once again said something that the lieutenant governor of Texas does not want to hear. Dr. Fauci said it in a British radio interview. And if you're wondering why Dr. Fauci didn't say it in an interview on one of your favorite cable news shows, it's because the White House usually does not allow Dr. Fauci to accept invitations to appear on most shows in this country. Every cable news show, every major newspaper is asking Anthony Fauci for an interview every day. We all are, every day. And that request, those requests are being denied by the Trump White House every day. For whatever reason, someone in the Trump White House gave the okay for Dr. Fauci to do an interview with BBC Radio Today. And Dr. Fauci said the situation in the United States is now much worse than it has ever been.
What we've seen over the last several days is a spike in cases that are well beyond the worst spikes that we've seen. That is not good news. We've got to get that under control, or we risk an even greater outbreak in the United States.
Why have you had those spikes, do you think?
When you look at the fact that we never got things down to baseline, where so many countries in Europe and the UK and other countries did, they closed down to the tune of about 97% lockdown. In the United States, even in the most a strict lockdown, only about 50% of the country locked down. That allowed the perpetuation of the outbreak that we never did get under very good control.
So that's why we are where we are tonight in the United States. We only did about 50% of the work that we needed to do, and we did it for a very short time. The two big lines on this graph show coronavirus cases in the United States and in the European Union. And in late March, the United States and the European Union were in exactly the same place where those two lines cross in late March, at about maybe 27,000 cases a day. And now the European Union is down below 5,000 cases a day, and the United States is soaring above 50,000 cases a day, and Dr. Anthony Fauci says we may be on our way to 100,000 cases a day, and 3 months ago we were in exactly the same place as the European Union.
Across the country, Americans are fighting to protect their rights and to free themselves from COVID lockdowns by appealing to the courts.
Called them up, we said, we got your names, we heard you were at the party, and basically you got the I'm no rat reply. They didn't want to give up names because they didn't want to tell about other people. It's a little bit of a human inclination. It's a little bit of a culture change we need to have. But this was always going to be a problem with contact tracing. That's why there's training that goes into it. Then came the subpoenas. Now, what about the guy who had the party, who knew he had symptoms?
We have subsequently been able to speak with him, and we have received full cooperation from him at this point.
But is there liability or exposure for knowing that you have symptoms and having a party anyway?
It's a foolish move for sure.
What does it tell you about where we are in the state of play?
It's very unfortunate, and some of the responses we initially received were, I don't have to give you information, I don't want to give you information, and there is nothing you can do to make me give the information. Not verbatim, but that was the attitude that was presented. And when the subpoenas were processed yesterday and delivered, within a few hours we had responses from almost everyone, and by this morning, everyone. That is before the time occurred, which was this afternoon, for them to respond legally. So they hurried and called and responded and gave the information, because at that point the risk for them to have to pay was quite high.
And look, timeliness is everything. You got to track down who else is there, who's exposed, and that's how you contain and you don't get a cluster. Where are you in terms of your ability to do this at scale in the state of New York?
So in Rockland County, we have been at this since our first case on March 4th. We're up to 13,590 cases at this time. We have been able to tackle this all along. We increased the number of contact investigators that we have, and then the contact tracers as well. And we're holding our own with this, with some additional help from the state contact tracers. But mostly at this point, we can handle this ourselves because our caseload has decreased.
What are you hearing around the state? You have enough contact tracing going on?
Seems to be. I know that they are at the ready, if there's a surge or when there's a surge in different areas.
Let me ask you something about strategic planning here and what we've learned. Is it weird to you that the states are all having to figure this out for yourselves and that there's not some kind of big national network at play with something like this, where there can be, hey, we need more. Let's call the feds because they, have this bigger umbrella and we know where the assets are, moving them around. Or do you think state by state is just the way it has to be?
I think that state by state is how it's designed to be at this point. Could there be a larger picture? I suppose, but that would take a lot of coordination. And at this point, as you know, the feds have taken over the supply of many of the equipment that we've needed, the PPE that was needed, and then it's to go to the states and then the states to the counties. And, they have loosened up lately, but we had some difficulty in the beginning with that. So I think having the feds do that and without full coordinated effort is probably impossible.
Well, listen, I'm glad it worked in this situation. Dumb idea to have a party when you're having COVID symptoms. Dumb idea to have a party, period. in this way because they weren't being safe about it. Hopefully it is one of those stories that people will learn from as we head into Independence Weekend. Doctor, thank you very much. I appreciate your cooperation and taking the opportunity.
You won't rest until you
required information for our contact investigations. It worked.
Right away, because it was threatening, what was it, a $2,500, $2,000 fine for every day that they didn't respond?
Up to $2,000 per day.
Can a contact tracer force people with subpoenas to divulge their private whereabouts, personal information very quickly?
Yeah, this raises a lot of constitutional concerns, right to privacy, due process. It's fraught with problems, absolutely, Raymond.
Mark, I thank you. Coming up with
those who served with honor, led with courage, and took this great nation into the future. Their words, deeds, and legacies will survive time immemorial. America's worst president will neither be remembered nor revered.
No, I don't take responsibility at all. We were given a...
He will be forgotten as quickly as we can. The Lincoln Project is responsible for the content of this advertising.
Let us pass mandatory mask ordinances. More than 15 cities throughout the state moved on that mandatory mask ordinance. What we need from Governor Ducey now is that he institute a statewide mandatory mask ordinance because the crisis is happening throughout our state. We are seeing 3,300 cases in one day, 4,800 cases the previous day. This is about saving lives, and the one step that Governor Ducey can take is instituting a mandatory ordinance statewide.
And Mayor Bethune, you're not calling for a statewide mask order in your state. Your governors, as I said, refused to do that anyway, but you don't think that would help?
I'm not saying that it won't help, but my position is I have to worry about my own city. And Myrtle Beach is a very popular vacation destination. We have people from all over the world who come here. So my position is I want to do all I can to protect our business community, our residents, and our visitors who come here so they can go home safely.
I mean, that's aspirational, and I share your hope that happens, but do you think enough is happening? I was looking at your list of rules for who doesn't have to wear a mask, and it seems like all sorts of people don't need to wear a mask. If you're exercising outside, if you're on a beach, all sorts. It doesn't seem particularly rigid, and to your point, unlike Mayor Romero of Tucson, you are going to see an influx of people from all over this country in the next couple of days. You probably already have.
Yes, we have, and that we do believe that is why our cases have spiked, especially in the past 3 to 4 weeks. And the mandate that was issued today will help. We believe that it will help. And the beach is a wide open space. Our lifeguards and our beach patrol are doing a great job of making sure that people follow the rules, that everything is spaced out. So the beach itself is not the problem. It's the masses of people who are coming here, and we just need people to take personal responsibility. That's what this is all about. And the virus is going to be here for a long time, and we all have to live differently. And unfortunately, this is something that we have to get used to right now.
Mayors, thank you very much for joining us. Regina Romero is the mayor.
Pray.com is the #1 app for daily prayer and bedtime.
World Tour movie. Justin Timberlake is here. We also have Russell Wilson, superstar quarterback, and Ciara, superstar singer, on the show, and music by the Avett Brothers.
In polls and everything. That's why they're in the streets. They're celebrating how much they love me. And I'm joining the party by tossing them a 6-pack of love gas. Those are just tears of joy.